So, depending on what preventative care organization you ask, I would say the minimum recommendation would be 3 times a week, 30 minutes of activity that gets your heart going. But really, that exercise can take a lot of different forms and a lot of different levels of intensity. I would say find something that makes you happy, that gets your body moving, gets your heart rate going, and something that you know you can keep up with in the long term. I'm Gabriela Zambrano Hill. I'm a family medicine physician. I work at Houston Methodist PCG Mont Bellevue. The best time of day to exercise is whenever you have time to exercise. So for some people, they prefer to do it in the morning because that's the best time in their routine. Some people only have time after dinner or at their lunch break. That's perfectly fine, just as long as it's something that you know you can do consistently. Depending on your individual health needs, a physician, a physical therapist, other professional may recommend to you a more high intensity type of exercise versus a low intensity kind of exercise. That's why it's important, if you have any concerns, to get medically evaluated first to see if there's any guidance into what direction you should be taking. In the case of a acute illness, usually I would recommend to my patients to take it easy, let their body rest and recover and fight off whatever infection they may have at the time. If we're talking about a chronic illness, such as hypertension, diabetes, hyperlipidemia, I will tell patients to go exercise as much as they can. Easily accessible ways people can add movement into their everyday life, that would be trying to avoid being sedentary, especially if you have a desk job. Lots of people have walking pads, or they have a little timer that makes sure they gets up and walk around once an hour, or perhaps even a standing desk. It's the change in position, that movement that is going to be good for you. I also always tell people, let's go outside more. Let's go for a walk after dinner. If you are lucky enough to have a store close enough to you, why don't we walk to go get today's groceries instead of drive? Playing with others. If you have any young loved ones, you can always go to the park and connect with them that way. Just trying to build it into your daily routine and the culture of your family.